Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. And today we have a very special guest. He is Dr. Eugene Zampieron, and we all call him Dr. Z. You can find him at Dr. Z Naturally. That's DRZNaturally.com. And Dr. Z is a licensed naturopathic physician, professional herbalist, author, and founding father of the University of Bridgeport College of Naturopathic Medicine, where he teaches courses in rheumatology, men's health, botanical medicine, and is a supervisory physician seeing patients at the University of Bridgeport Clinic. So, Dr. Z, welcome today to Herbally Yours.
Thank you, Dr. Kamhi. It's great to be here.
Now, before we get started in our topic, we're going to talk about men's health and andropause in particular. I do want to talk a little bit about the naturopathic clinic, because I think that is such a wonderful resource for those people who'd like to get a much deeper view, since naturopaths look at what's going on with someone from the auspices of cause, rather than just trying to use pharmaceuticals to cover effects.
Yeah, the clinic sees patients and tries to look at the underlying conditions. Like, give you an example, someone has high blood pressure. We try to run tests to try to figure out why that patient's pressure went high, and that might take some investigation and digging, but we do it and very effectively. And then it's low cost and very helpful for the community. And we do a lot of holistic medicine testing that's not even available in New York State. So it's a real special place.
That is true. That's why I send many people who come to see me for consultations, I send them there to get the test, because you could spend thousands if you had to just pay out of your pocket. And like you said, many of these tests are not available in New York State, but are absolutely legal and available for you to order in Connecticut at that particular clinic. And so that is the College of Naturopathic Medicine at University of Bridgeport Clinic, and anyone can find them online and get in touch. So thank you for that, Dr. Z. Now, what made you become a naturopathic physician?
Well, I had a personal conversion when I was a young lad. I was interested in marine science, but when I was in Jamaica, I was actually cured by a Jamaican bush doctor, and he was a guy that didn't really go to high school or college, but yet had an amazing knowledge of the flora of the rainforest. And so I was always interested in medicine, but I just didn't want to go the conventional route. So I ended up apprenticing with this now deceased shaman, Jamba. And that led me to find out about naturopathic medicine, which before the internet was kind of hard to find out. But there was a small accredited program out on the West Coast, which is now a well-established program, the Bastyr University of Natural Health Sciences. And that's how I became a naturopathic physician. So my love of plants and helping people merged.
Now, I do want to give a disclaimer here on our show today, because Dr. Zampieron and I are not only personal friends, but we are business partners, and we are actually business partners in a business called Natural Alternatives that we put together. And I think it's 35 years now, Dr. Z, something like that. It isn't just yesterday, because Dr. Z did not have children at the time. He was not even married at the time. He was a young baby at the time, just getting out of medical
today's
school.
Kevin's birthday, by the way.
And how old is Kevin?
He's 23 today.
Oh my God! So now his two children, like another quarter of a century old. So this has been a while for sure. So Dr. Z, you are really one of the most knowledgeable people I have ever met, and I'm so happy to partner with you in conferences and lectures and radio shows like we're doing together today, and many, many books that we have written. You can find those at naturalnurse.com books or Dr. Z's site, drznaturally.com. Let's talk about andropause, since that's our topic for today. People have certainly heard the word menopause, so we know what menopause is in women, but the term andropause is certainly not as well recognized. What does andropause mean?
I always tease my students that we should have left the word menopause for men, M-E-N-O, but anyway, it became associated with a decline in women's health and a constellation of symptoms that they get. Same thing in men, although we don't have menses, and we don't have such an abrupt cessation in hormones, men, as they approach middle age, let's say, although now, unfortunately, in today's society, it's becoming much earlier. We could talk about reasons why. We get a change and fluctuation in hormones, like particularly testosterone and maybe a rise in estrogen, and that can lead to some very serious health problems for men. And so our job as naturopathic physicians is to, and regular physicians too, is to kind of stave that off. Look, are there any signs that this is happening in the guy? Do they have any symptomology that's problematic? And then give them a course of action to prevent it.
Well, one of the things I think is that this is very under-recognized because women are sort of given a pass at that time of life. And I do want to tell our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is Dr. Eugene Zampieron at drznaturally.com. Now, people recognize menopause, as you said, Dr. Z, and a lot of women, as they get to that age, they're kind of given a pass about why they're, maybe in kind of a bad mood and having a little anxiety. They go, oh, it's just menopause, not being able to sleep through the night, having night sweats. And I think it really does men a great disservice because they are not recognized to having these very similar changes, so they're not given the same pass.
Absolutely, and there's so many symptoms associated with it. For instance, loss of libido, erectile dysfunction, lack of concentration, depression, lethargy, irritability, and sleep disturbances. But the more troubling ones would be, high lipids, high levels of inflammation, weakness in the body, weight gain, and heart disease too. This is a troubling thing, and I always tell folks that there's you could go to the doctor with 6 or 7 complaints and be on 6 or 7 different prescriptions when all you need to do is regulate your testosterone, and then you could be off of those 6 drugs. So it's a huge constellation of symptoms that even isn't recognized by conventional physicians as of yet still. Because there's no diagnostic code, by the way, for menopause, for andropause.
Oh, I did not know that. I did not know that. So
there's failure of your testes. There's horrific things like failure of your testes diagnosis codes, which, poor guy. But, yeah. So hopefully we'll change these things over time.
But certainly many men who are listening, or if their, partners are listening, they probably know that as people get to, and it's not a specific age, right? It's not like at 50, but somewhere around there, depending on the person and their change in hormones. So what are some of the common symptoms that men might experience?
Well, like I said, loss of libido, erectile dysfunction, lack of concentration, even depression and lethargy, tiredness. The Chinese have always said weakness of the legs and back. It's kind of fascinating. And, that is pan-cultural. You see the same thing talked about in the rainforest of Jamaica as they do in ancient China, when the guy's back gets weak, and all these different herbs have come about, strong back and lots of rootsman tonic and things that we've experienced on our travels to Jamaica. They're all meant to stave off andropause, because ancient cultures recognize this as a problem in men. And so, and it has to do with machismo and virility, and that's oftentimes the first time a guy will go to the doctors when he's having problems with erections or something like that. But it's really a systemic problem that the doctor has to then look at, and just giving him Viagra or some drug like that really is not getting to the root of the myriad of causes of why this is happening.
Now, also, of course, the issue is that they have to look for it. Like you said, Dr. Z, so many men in that age group, they're just immediately put on a whole host of pharmaceuticals, starting with the minute their cholesterol level is over 200, they're put on statin drugs, which actually lead to nutritional deficiencies that cause some of the same symptoms that you're discussing.
Absolutely. Cholesterol is the building block of the sexual hormones. Believe it or not, cholesterol is a good thing, not a bad thing, and we've been brainwashed in culture that the moment the cholesterol goes up to take something to lower it. Well, why would you lower something that is very important for your whole health of your brain, memory, making hormones, making testosterone? They're all what they call steroids, and cholesterol is the building block of all the steroids. So the real issue is, why is the cholesterol elevated? Maybe it means that the body wants to make more hormones, or the body needs to make the cholesterol. True, there are bad types of cholesterol. I wouldn't say bad, but doing something different. But basically, cholesterol is something that fixes other things. So you're killing the messenger, and not getting to the message, like the old saying goes.
That is so true. And definitely, we wrote a whole article on that as well. All the scientific evidence showing that the cholesterol level is not really that important. That's not what you want to bring down. You certainly want to bring down that sticky fatty substance. So not only do you have to look at something like HDL, which you want to raise up, that's the healthy fats or the healthy cholesterol. Even if somebody has elevated LDL, you want to measure that to look at the particle size, like ApoA to ApoB ratios. And without that, you have no information about, is this cholesterol really good cholesterol for you or something that might cause a problem. Either way, just lowering that number artificially through the use of a statin may not be the best treatment for the individual, particularly because that brings on more of the symptoms of andropause that you discussed.
Yeah, and there's been some pretty scary studies where they looked at the patient's testosterone along with their vitamin D, along with their, blood steroids, and found that it really predicts, unfortunately, mortality. So, in other words, having a low testosterone and a low vitamin D and too low of a cholesterol actually creates more mortality in men than many other measurements. So these are what we call predictive measurements. These are measurements that every doctor should be doing when a guy, 40s, 50s, 60s should go to the office and get checked out, because these are predictors of potential disease. And so that's the time when we need to do in preventive medicine important lifestyle changes and things like that to stave that off.
Well, we're going to take a little break here, Dr. Z, and I'd like to remind our listeners you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information on today's guest or topic, email us at whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
90.3 WHPC reminds you that when your loved ones need help getting around, you're more than just a daughter or a son. You're their driver, personal shopper, and financial manager. And then before you know it, you're their cook, personal assistant, physical therapist, and even nurse. When you start taking care of a loved one, you don't realize the challenge of playing so many roles. AARP understands the many roles you play, and to help, they've created an online caring resource center for the over 42 million caregivers in the U.S. who are caring for a parent or loved one. At aarp.org/caregiving, you can find local resources and connect with experts and the caregiving community. Better care for ourselves and the ones we love. Visit aarp.org/caregiving to find resources. Brought to you by AARP, the Ad Council, and the voice of Nassau Community College, 90.3 WHPC.
And welcome back to more right here on Herbally Yours. Thank you for joining me, your host, Ellen Kamhi, the natural nurse. And today I am so happy to be on board here with my illustrious business partner, Dr. Eugene Zampieron, who is very instrumental at naturopathic medicine. He's a doctor of naturopathic medicine, licensed by the Board of Naturopathic Medical Examiners in Connecticut, and he has a private practice in Woodbury, Connecticut, as well as his involvement as a professor at the University of Bridgeport Department of Naturopathic Medicine, where they also have a wonderful clinic where you can access a lot of the tests that we're talking about today. So that's a resource for our listeners. If you're local here on Long Island or if you're anywhere in the world, you can get in touch with Dr. Z about that. And what our focus for today is andropause and men's health, one of the many levels of expertise that Dr. Z has. So, Dr. Z, you talked about the fact that andropause may be dangerous. Now, do you know, and probably you do know, that Medicare does not test or does not cover testing for vitamin D? You just talked about how important that is to know your level.
Yeah, they just changed that. So
I know.
Unfortunately, you have to have rickets now in order for them to cover it. So they're not, even though the science is there, the powers that be have, found reasons to have people pay out of their pocket. But you know what? It's worth it. I think it's very much worth it to know what your D is. And a lot of these tests, I think, like looking at your CRP, which is, C-reactive protein, an inflammatory molecule that can predict all kinds of inflammation in the body. Because that's one of the big things that causes andropause, Dr. Kamhi, is inflammation. There's a constellation of things that we should discuss briefly that I think is the leading cause of andropause. One would be toxicity. 2 would be stress. 3 would be nutrient deficiency or other types of things like, problems with the testes and Klinefelter syndrome and some genetic things and things that most of the times people have ruled these things out. It's the toxicity and the stress thing that tends to be things that we focus on in holistic medicine.
Yeah, because those are the underlying factors that we don't just take a drug and cover up, but the person has to participate in creating change.
Exactly. So, if you're under a lot of stress, instead of the hormones going to build testosterone, they go to the fight or flight response, and they build cortisol. And so, which then, of course, increases the weight, and weight gain happens also. The more fat in the body, the more the testosterone gets changed into estrogen. So right then and there, we have, the obesity epidemic. These chemicals, actually, that the toxins that I was talking about are actually called obesogens, and they can
wait a minute. I never heard that word.
Yeah.
Obesogens. So those are hormones that create, like, becoming fat. Everybody's interested in that.
Yeah, and they kind of increase fat, and then there's a enzyme called aromatase, which then takes the testosterone and turns it into estrogen. So this is the problem, because if you go to like a conventional doctor, they may say, "Oh, your testosterone's low. Okay, we'll give you a cream of testosterone or a shot of testosterone." But without addressing the aromatase issue, all that testosterone you're taking is going to be converted into estrogen, and then that's going to further compound the problem. So you have to almost try to coax the body to not do that. And there's different ways to do that in naturopathic medicine and herbal medicine, which is, your main topic on the program here. And then stress, of course, you have to try to practice meditation and do stress management things, because if you're under a tremendous amount of stress or distress, because we're all going to be under stress, but if you let it really bother you too much, then it's going to, all that testosterone is going to be converted into stress hormones, and then you're going to be andropausal again. So you could see that there's many ways of stealing the testosterone away and creating disharmony in the body.
So I think one of the first things is recognizing that in fact is an issue. And you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse. And my guest today is Dr. Z, and that is Dr. Eugene Zampieron. You can find him at drznaturally.com. And today we're talking about andropause and men's health.
Yeah,
so what are some of the things men can do? First of all, like you said, maybe get tested, realize it could be a problem, right. And then what?
Well, if it's stress is the problem, there are herbs that put your adrenal glands to bed, so to speak, which is, your adrenal glands are much related to the fight or flight response. And we would use things like drinking chamomile throughout the day versus a coffee. Using stronger relaxants such as skullcap or Schultzia, which is California poppy, or sometimes people need more very powerful relaxants such as wild lettuce or corydalis or Jamaican dogwood. And then things to help their adrenal glands, possibly things like ginseng, Siberian ginseng, and what we call adaptogens, which are herbs that help people adapt to stress. The stress is still there, but it doesn't affect that, what they call the hypothalamic pituitary adrenal axis, which is involved with that fight or flight response, or the sympathetic response too, which makes adrenaline. So you need to really put the genie back in the bottle, as they say, with the stress, and then there'll be more hormones left to go to the testosterone pathway. And then certainly I think men can clean up their act with toxins. For instance, like many cosmetics have been shown to induce andropause. So we call them pretty poisons, the pretty poisons that we use and the cosmetic industry has unfortunately put upon consumers. So the old saying is, if you can't pronounce it, don't put it on your skin. Don't put it in your body. Eat clean, because that's how the pesticides and herbicides, there's a lot of research that show that they will affect the Leydig cells in the testes, and that's the cells that actually make your testosterone. So living clean and stress management, two very important things I think people can do to help with to prevent the andropause from happening. If they actually have andropause, there are herbs that have been evidence-based to raise testosterone. And there's a lot of hype about this, and there's a lot of herbs that really don't raise testosterone that are purported to do so. But I've done a lot of research on the topic, combing through the literature and trying to figure out the best herbs to do this. And so, that's what I've come up with.
So tell us which ones, Dr. Z. How about deer antler velvet? I've heard good things about that in terms of andropause.
Well, again, you know what's interesting? That's one that did not raise testosterone.
Okay.
It did increase libido, and it did increase growth hormones, but it did not raise testosterone in some of the research. So there you go. That's a good example of something that is a tonic, there's no doubt about that, in Chinese medicine, and does certain things, but doesn't actually raise testosterone. Things that really raise testosterone, one of the best ones is the root of the stinging nettle. What that does is that blocks the 3 enzymes which disable testosterone. You have something called DHT, dihydrotestosterone, aromatase, which we talked about. That's the belly fat hormone that makes the testosterone into estrogen. And then there's another one called sex hormone binding globulin. So these are things that are made by our body, but they take the testosterone and they squash it, they bind it up, they make it not available to the body, because it's the free testosterone, which is the most important measurement that men need to ask their doctors to get. They should get their total testosterone done, but many times people come in with lab work done by other physicians, and I noticed that the physician ran the total testosterone, but not the free. It's the free testosterone that does all the work, and nettle's root is what raises the free testosterone. And so that's really been well researched, and I've seen so many men benefit from taking the root of the nettles. How much would they take? Probably, if they'd taken the average tincture, several teaspoons per day of the tincture.
Thank you, Dr.
1
Z.
to 2 tinctures.
Believe it or not, we are out of time, so thank you for those wonderful suggestions and really elucidating. And of course, our listeners can find you at drznaturally.com, or they can get in touch with the University of Bridgeport College of Naturopathic Medicine in the clinic and actually come get some of these workups there. So I want to thank you for tuning in to Herbally Yours, listeners, which is produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.